Hello. Hi, my name is Paula Ekstrom. I'm the president of the League of Women Voters of McHenry County. I would like to welcome all of you tonight and tell you a little bit about the League. The League of Women Voters just celebrated its 104th anniversary since its founding on February 14, 1920 at the Congress Hotel in Chicago. The movement for women's suffrage began in the summer of 1848 in Seneca Falls, New York, and after 72 years of fighting for the right to vote, Congress finally passed the 19th Amendment to the Constitution on June 4th, 1919. It was ratified by the last state, which was Tennessee, on August 18th of 2020. And women were allowed to vote for the first time on November 2nd, 2020. The League of Women Voters was formed with the mission of promoting education of all voters, especially women, and that is why we are here tonight. The League is a nonpartisan, issue-oriented organization that does not endorse or promote candidates. If you are a registered voter, you are now eligible to vote, and voting has started at the county clerk's office in Woodstock. You may also request an absentee ballot by contacting the county clerk. If you still need to register, you can register and vote in person up until and on Election Day. And we are here tonight to talk about the question on the March 19th ballot, which we will consider tonight. And that is, to pay for mental health purposes, shall McHenry County be authorized to impose an increase on its share of local sales taxes by 0.25% and discontinue the current property tax funding mental health services and the Mental Health Board. The panel tonight will be County Board members Carolyn, Campbell, and Michael Skala, Executive Director of Family Health Partnership Suzanne Hoban, and John Buckley, Executive Director of Independence Health and Therapy. After the presentation, we will have some time for questions. You may submit questions by writing them on cards that are provided to you at the door and by members of the League who are circulating around the room. When you've finished I'm sure the questions will be elicited by the presentation. When you finish your questions, please hold the card up so somebody can pick that up. Questions will be reviewed by League members, and some duplicate questions may become combined. We'll try to answer as many questions as possible during the allotted time. We hope to finish by 8:30. And now I will turn this over to the person who is supposed to start this off, and that is Mike, I believe. And do you want to come up? You're going to have to advance the slide.
We got it.
Oh, okay. Okay.
Good evening. Thank you very much for coming, everyone. First, a little bit about myself. So I'm Mike Skala, McHenry County board member. Been a board member since 2012. So coming up on my 12th year. I serve District 9, which is basically Huntley all the way west, all the way to the McHenry County line with Boone County. I'm chair of finance and have been for I think eight or 10 years. And so tonight I was asked to be here. To me, it's just to provide information for the public. To me, this question was an option that was put on the ballot so that voters had a voice and voters had a choice as to how to fund mental health. So I'm not taking a position, yes or no. It's up to the voters to decide. To me, that is the most important thing when it comes to money, is let the voters decide how they want to do things. It's local control as far as I'm concerned, and so I was happy to have this put on the ballot so that you guys had a choice. Real quick, I'll go through a couple of slides here. There you go. So this is a little information about the history of the Mental Health Board. So you can, I don't want to read verbatim, you guys are all very intelligent people, can read it for yourselves. But basically, it started in 1963 with President Kennedy. In 1967, the voters approved a 708 board, which is important. We were one of the first in the state of Illinois to do that. And it showed the importance that the voters at that time had feelings for mental health and the ability to service those people that need those services here in McHenry County. And it's continued to this day. Sadly enough, we're not funding enough for the needs that are greatly expanding here in the county, which again is one of the reasons for the question that's put before you today. But it was the history of how we got where we are today. Next one. So this is the actual mental health board here in McHenry County. So it consists of 9 members. They are community representatives, so they're appointed by the county board, but they're community representatives, so they're from all different walks of life. And we feel that's, when we go to appoint people, we look at their background and how we feel that they can help fit the needs for the mental health board. So they act on our behalf to administer the tax dollars that are raised. And then the next one talks about how the money, so currently it's through property taxes, and that money then gets distributed to the mental health board, who then goes through an interview process and takes those dollars and then distributes it to different agencies. You can see all the different agencies that they distribute money to. So the amount of money and who it goes to is done by those 9 members. I don't envy their position, because it's very difficult when you have the need is much more than what money they have to allocate. And so they have to make choices, and they make choices to the best of their ability, but it's never an easy choice for them to make. So this is just 3 programs that the Mental Health Board funds. Suicide prevention training. We've had an increase in suicides here in the county. It's becoming a larger problem. COVID definitely exacerbated that issue, didn't help it. Live for Lolly, we've also had an increase in drug usage, and again, I hate to say that those numbers are increasing on average also, so that's also a real problem here in the community. And then last is New Directions, which again is a program to try and help those people that are going through those crisis moments in their lives.
Okay, so my name is Carolyn. Oh, that's okay. My name is Carolyn Campbell, County Board Member for District 3. That covers a small part of Crystal Lake, most of Lakewood, most of Lake in the Hills, the western 1/3 of Algonquin, and a very, very small neighborhood in Huntley, actually, as it turns out. I've been on the county board since 2022. I was appointed in February of that year, and then went on to run for election and won a 4-year term. I also sit on the finance committee, and so we thought we would work together to talk about why we got here. The current slide here is the Mental Health Board's current state. So for the 2024 budget, they had asked for a $2.5 million increase in their levy. And the reason for that is because of 10 years of relatively flat funding for their programs. So it seemed like a big ask, but they had gone through and looked at the state of of mental health in the county, and this is what they assessed their needs needed to be. During this budget process, we awarded them $525,000 in their levy increase, so nowhere near what they needed or what they were asking for. And the likelihood of future increases for property taxes, it's difficult, and we'll get into that in a minute. So if you, this graph here just shows that level of funding over the last 10 plus years. Several years ago, it's a little bit hard to see here now, but there was actually a decrease. That's about 5 years ago. And so the funding is not actually keeping up with the need. This next graph shows how, and this is the levy rate. So the mental health board levy is aggregated in the county levy. And what this graph is showing is that over time, the percentage of the mental health board levy as part of the total levy for the county is actually going down. And so what we know is this. There was a health community needs assessment that was conducted by our public health department, and they identified behavioral health as one of the top priorities facing residents in this country. We know our needs are going up. We're going to talk about that in a minute. The cost of providing services is going up. So that brings us to why we're here today and how we got to this point. And each individual board member got here in their own way, but the decision to move forward with a sales tax referendum and have voters weigh in is bipartisan and nearly unanimous. We had a couple of people who either abstained or said no, but that was more about timing than an actual outright no to posing the question to voters. So to be fair, and if you think about the flat funding over time, and to be fair, there's a lot of concern, there's a lot of pressure put on elected officials to keep their property taxes down. And you can talk to anyone in the county and you'll get different answers about how they feel about property taxes. There are people who are not bothered by them. They recognize the value they get from them. They think it's a good value. They come here for the schools, which is where most of the property tax is going to. That accounts for about 60 to 80% of your tax bill. They see the quality of life here, the access to parks, open space, recreation, libraries, police and fire, and so a lot of services come with their property taxes. For other people, it's not so easy. And property taxes for people on a fixed income, also, for example, in retirement, it can kind of push them out of their home as property taxes continue to increase. Young people are having a hard time finding housing that they can afford. We have high property values here in McHenry County, and you couple that with high property taxes, and it's very difficult for young families to purchase their own home and to start building equity and financial independence. So that brings us to this question: how do we find a revenue source or a funding source that's going to meet this critical need in a sufficient amount to keep up with the rising demands and the rising costs of providing those services? So we're bringing forward the sales tax. We can get into more discussions about, where we fall in this country about property taxes. Some people think it's the highest in the country. We're really, as a county, we rank about 28 if you look up on the taxfoundation.org. But if you look at the state as a whole, then if you look at effective property tax rates, then we are second behind New Jersey. But again, how you feel about property taxes depends on your situation, but it does beg the question, how do we provide these services? So we're going to move into the needs, and then we can talk further. We'll have opportunities for questions. Thank you.
Good evening. My name is John Buckley, and I'm Executive Director for Independence Health and Therapy. And as it relates to tonight's conversation, one of the services or service areas we offer is behavioral health services. So our organization offers psychiatry services from ages 6 on up, counseling services from ages 6 on up. We provide community support, coaching, and so we do a wide variety of mental health and behavioral health services. So we are here to talk about the need. Thank you. So as Carolyn referenced, the need has been increasing in our county, and it's a national epidemic of mental health needs across the country. And so up here's a handful of little stats. 40% of adults have reported feeling nervous, anxious, or edgy every month. Suicide and self-harm rate has gone up to 81.5 per, or 81.8 per 100,000. That's well above U.S. norms. That's well above the Illinois averages. In 2022, there were 45 deaths by suicide. But if you start to parse out the numbers as it relates to adults and begin to pick into certain groups, you can pick caregivers. Caregivers have been in national level conversations quite a bit in the last couple of years. There are about 40,000 unpaid caregivers in McHenry County. 50% of those report feeling high levels of stress related to their caregiver responsibilities. So what you're looking at is you're looking at the equivalent population of Crystal Lake being caregivers and the equivalent population of Woodstock feeling stressed about their caregiving. Seniors, 25% of seniors in our county are socially isolated. And that also has been coming up in the news of late because the health impacts of social isolation are equivalent to smoking cigarettes. So you're looking at about 15,000 seniors in our community that are socially isolated. So if you want to go to the next one. No, thank you. So then if you start to roll that down to the younger people in our community, and this was a national level study that was released in 2022, so the data is reflective back to 2021, and it talked about high school students and how they're feeling of persistent feelings of sadness or hopelessness. High school girls went from 36% in 2011 to 57% in 2021. High school males went from 21 to 29%. So again, as you draw that down into kind of a context that is relevant to our community, and I know the numbers aren't exact, but Woodstock High School, where my two boys went, let's say they had 1,000 students. You're looking at 285 females who have persistent feelings of hopelessness and sadness, and you have 145 males who are feeling the same thing. That's a lot. That ends up being about a third of the school. And then if you take it to the next step on the feelings of seriously considering suicide, again, high school girls went from 19% to 30%. So at Woodstock High School, so one high school in a town of 3, and there's lots of high schools in this town. There's 18 high schools in this county. At one high school, there's 150 high school girls who have seriously considered suicide. And you've got 70 high school males who have seriously considered suicide. So we know that this is an ongoing epidemic that is not going away. So if we talk about what we are able to do about that right now in our current capacity, and at the end, there's a slide that will show you the sources for this information. And Carolyn referenced the community healthy community study from the county. In that, it recognized the top 4 issues for residents that were reported by us. So as residents, what did we say were the biggest concerns for us? The top 2 were access to care and substance use and behavioral health services. So we're concerned about the behavioral health needs of our community, and we're concerned about our ability to access the needed care in order to address those. Illinois is a mental health professional shortage area state. It's defined by the Kaiser Family Foundation, and it says that we do not have enough mental health professionals in our state to meet the need. And they really structure that around psychiatry. And last year, we needed 300 more psychiatrists to meet the existing need. I went and looked earlier this week, and they updated it for 2023 going into 2024. We actually need 425 psychiatrists just to meet the existing need in our state. And I can tell you, rolling that down to McHenry County, practically, it's virtually impossible to find psychiatrists. You can talk to that. I know people in the audience can talk to that. So we are already behind the 8 ball, and then McHenry County is further behind the 8 ball around this issue. Over the past decade, again, this is in the Healthy Community Study, we have seen the number of counselors or mental health professionals in our community decrease based on the population. So 10 years ago, we had 1 counselor for every 200 residents. Today, we have 1 for every 600 residents. And we do lots of things well in the state. We did not do that well because in the state of Illinois, it went the other way. So we are going backwards in this area as well. So if we go to the next slide. Sorry, I lost my notes. Oh, there we go. So Illinois Partners for Human Services released a report last year called Gauging the Gap. And this comes back a little bit, ties into what I was just talking about the number of caregivers, the number of providers that we can meet the need. Across the board, the services that are funded by the Mental Health Board, intellectual and developmental disabilities, domestic violence, behavioral health, homelessness and supportive housing, older adult services, are all suffering from a significant staffing shortage. And that goes back to our ability to pay, it goes back to the ability to train, it goes back to the ability to recruit, but across the board, all of us are struggling with staffing. So when you take that to what mental health provides, in the 2023-24 applications that reference the $2.5 million that weren't funded, you can see we were flat funded or we lost funding. So we lost staff, we lost capacity to serve. And things that we need in our county aren't even beginning to be addressed because we can't meet the current needs, let alone address the needs that are coming. So it is an ongoing and pervasive issue. So the last slide is just the sources for that data, so I will pass it along.
Everybody still awake out there? Tax? No, not you personally, just the whole tax thing in general. You were fascinating. I was riveted. My name is Suzanne Hoban. I'm with the Family Health Partnership Clinic in Crystal Lake, and we serve primary care for the completely uninsured in McHenry County. And you're probably wondering, what does a primary care clinic have to do with mental health? Pretty much everything. Because for the most part, initially, mental health issues are diagnosed in the primary care office. And there are more prescriptions for psychiatric drugs written by primary care physicians than there are psychiatrists and other providers combined. So primary care has a lot to do with mental health. And you can't separate mental health and physical health. People will come in with persistent recurring headaches. There is no biological cause that can be shown from that. But what we find when we dig a little bit deeper is that they are in a domestic violence situation, or they are depressed, or their children are causing them stress, anxiety, they're in a difficult relationship. All of these things contribute significantly to someone's physical health. And so that's why I am pretty passionate about this. And I'll tell you that I'm also passionate not just from a professional perspective, but my daughter was one of those people who in high school seriously considered suicide. Luckily, my husband and I had very good insurance. We had a great support system of friends, neighbors, and our families are amazing. We had absolutely everything to walk her through getting out of that. And she did, and she's doing beautifully. Not everybody has that advantage, and I am very well aware of it in my work every day. So let's talk about the mental health sales tax referendum. Lynn, can you click? Thanks. So on December 19th, the McHenry County Board voted to put this following question on the ballot, March 19th, and I will read it because it is important. To pay for mental health purposes, shall McHenry County be authorized to impose an increase of its share of local sales taxes by 1/4% and discontinue the current property tax levy funding mental health services and the Mental Health Board. So what we're looking for is we are looking at a 25-cent increase on every $100 spent. And there are certain things that are exempt from this: food, medicine, medical supplies. And that was really where my tipping point was. I was extraordinarily concerned about a retail sales tax harming or being more of a burden on the people that I care for and that John cares for every day. But when I learned more about the referendum and what it actually said and what was going to be taxed, That was the tipping point for me. And there are many, many service organizations who are dealing with these very, very challenging patients and clients and people who are very needy, who are very much in support of this and recognize that this could be a very good way to move forward. So we'd like to do some FAQs.
Can I, before we do the FAQs, so just to provide a little bit of background why the county board decided to put the question on the ballot, just so you can have a perspective. So every single year we go through a budget process, and as chair of finance, I'm responsible for, along with the administration, presenting a budget to the county board that ultimately gets voted on. For the last several years, we've had difficulty getting a budget passed. And we're a county board of 18 members, so ultimately, at the end of the day, I need 10 votes to do something. Whatever that something is, I need 10 votes to pass it. And so we have a very diverse county board, which is great, because it actually does you guys a really good service as far as thought process and fiscal responsibility and putting your taxpayer dollars to good use. But that being said, part of my job is threading that needle. So we have county board members that, in this particular case, see a strong need for mental health and are willing to spend dollars to put towards it. We have the other side of the spectrum, which is people that don't want to raise property taxes for any purposes. And so ultimately, I'm trying to thread that needle and figure out where is the happy medium between both paradigms, and ultimately find 10 votes to get something passed. It is becoming more and more challenging year over year, not because of the county board members, but because of the pressures that we see. And this, mental health is just one of the pressures that we see. And so when we had this opportunity and this came up about potentially using, a 1/4-cent sales tax to fund mental health, most of the county board members were very supportive. And not because of the reason because it's taxing, but because property taxes are high, and all the county board members recognize that. And so, we, on finance, we really took the question and dissected it and wordsmithed it, because, what we didn't want was there to be any confusion by the public when they're going to the polls to vote on it. And we want to be very clear that if you say yes, then we are going to take the $10.75 million out of your property taxes completely. It's not a must, or we will be doing that. And so we wanted to make sure that that was very clear in the question. And then the second part is that it would be funded with the 1/4 cent for every $100. So that was kind of how we got to it. If in fact it doesn't pass, then the county board's right back to where we started. We still are going to be threading the needle, trying to figure out how to pass budgets, how to meet the needs of not only mental health, but all the other services that we offer here in the county. And so, but again, like I said in my opening statement, it's important for me to allow you guys to have that voice, have a say in what you want your taxation to look like. I know there's been comments about, well, it's going to end up costing me more. And in some people's situation, that may be true. In others people, it may not be true. But again, I don't want to be making that decision for you. I want you to have a voice to be able to make that decision. So that's kind of where we got here. And, as a county board member, whether it passes or fails, we're going to continue to try and do the best we can with the money that we have. And ultimately, we're going to pass budgets that ultimately will provide services. And what those services look like will be based on the amount of money that we choose or have 10 votes to ultimately pass a budget.
Okay. So here are some of the questions, and these are also on the county website. These are important ones because these are the ones that most frequently come up. What's the effective date of this? Should this pass? It's July 1st, 2024. And when will residents see property tax relief if the referendum passes? I can't guarantee that anyone will see relief. I can tell you that the $10.7 million will go off of the property taxes effective December 1st because that's the beginning of the new county fiscal year. If the referendum fails, this cannot be brought up for another vote for another 23 months, and that $10.7 million will remain on the property tax rolls. What is our anticipated revenue? Well, it's never an absolute what we are going to be able to get from this, but in reality, it's never an absolute what we'll be able to get from the county board either. No disrespect intended, but we've got a lot of competing interests out there. So it is expected that we will get somewhere between $12 and $13 million to fund mental health services at the end of the first full year. And we've got a graph on here. The county calculated this out based on the RTA sales tax. And so this is kind of how we expect the retail tax to go. You'll see that the green is actually where mental health funding has been for the last several years. So again, there will be an incremental rise we expect through the retail sales tax. That will at least help us attempt to keep up with the rise in demand and the need that all of us are seeing. The question about how much am I going to pay? Well, it depends. How much do you buy? So first of all, I want to reiterate, this is not on food, this is not on medicine, this is not on medical supplies. So if you have a home that's worth $250,000, currently you pay about $78 towards the mental health board. In order to equal that through a retail sales tax, you would have to spend $31,000 excluding those other items. Okay, does that make sense? People nodding? Yes, excellent. Okay, so that's kind of where you fit. So you can kind of look at what your home value is and kind of get an idea of what that impact may look like for you. The current property tax levy for the mental health board currently is set at $10.9 million. Go ahead for what's exempt. I already went through that, so I'm not going to go through that again. And does it fund services for disabilities and substance use disorders? It absolutely does. It covers a wide range of services that are provided within our county. Who else does this? Winnebago does this. They actually have a double the retail sales tax for mental health services that we do, but they have had that for a few years, and it has proven to be fairly successful in that. What services does the mental health board provide? The mental health board itself does not provide any, but it does fund services, and it helps coordinate services. On a previous slide that member Skala showed, you had a list of them, and they're also on the county board website, and we have some lists out in the hallway as well if you'd like to see who gets funded by them. And will the property tax be uniform around the county? Yes, it will. This has nothing to do with municipalities. It will be completely across the county. And how can you vote on this referendum? Well, you need to vote March 19th or before. And you can request a nonpartisan ballot if you choose not to want to declare one party or another. And this referendum will be on the nonpartisan ballot. And, I think Liz. Oh, sorry, go one more. Oh, there we go.
Okay, so yeah, on the website we had put down February 20th as the date, which was 2 days ago. But that was more for mail-in registration. There are a couple other ways you can register. You can register through March 3rd, end of day, online through the State Board of Elections. There's an application, voting application site there that you can, link that you can get to there. You can also vote, register in person during early voting or even on election day. You must, obviously, you have to be a citizen. You need to be 18 years old by the date of the November election. 18 or older, and you need to have 2 forms of identification. So we need to build on this on the county website, but wanted to make sure everybody was aware of that as well.
And I think we're ready to take questions from the floor and from the
Okay, can you hear me up there all right? Okay, hi. My name is Mary Finch, and I'll be asking the questions. Question number 1, I think this might be for Suzanne. How are the social workers in police departments working with the various agencies that provide mental health services?
This is an amazing and revolutionary program that the Mental Health Board is funding, where social workers are working hand in hand in partnership with the various police departments, because many of the police calls, in fact, involve mental health issues rather than truly a criminal issue. And so the methods of de-escalating and the disposition of that event can be very, very different depending on whether it's addressed through a police officer or through a social worker. So there are now social workers embedded in, I'm not sure how many, 19 of the police departments, and the program is working beautifully. And this is just one of the very innovative programs that the Mental Health Board does fund.
You know, I would add that in talking to Amy, who actually helps to oversee that with the Sheriff's Department, they are already finding a 73% drop in recidivism for those families where you would go back to a family, you know, to maybe to a household repeatedly because it was just, you know, calming the situation down and then going back again and again and again. That they've already started to see a drop of 73%. So it's working out really well.
Okay, thank you. Second question, this would be a board member. Since the levy was already set for 2024, are we being double taxed if the sales tax goes into effect on July 1, 2024?
So from the time that the sales tax goes into effect until our budget starts December 1st, yes, technically you'd be paying both the property tax and the sales tax at the same time.
Okay.
Okay, and I could add to that. So we're estimating that it's about, when we talk about it being about a $12 to $13 million revenue source when it goes to the full, you know, the sales tax of the 25%. We anticipate it's about $1 million per month. Right now, they're so underfunded that you're talking maybe 5 months of that overlap, $5 million. That's going to be an opportunity for them to get their resources, funding under control, have some, you know, available to them to also offset any fluctuations going forward with the sales tax, but that's about what they're looking at. But they're already underfunded, and that so we do have a bit of an overlap there.
Okay. Back to Suzanne or John. What mental health services do seniors need, and do we already have adequate resources in the county to meet those needs?
I'll take that one. So Independence Health and Therapy was created about 5-6 years ago. So folks may remember Family Alliance was an organization in Woodstock prior to our merger with them. And their focus was older adults. And so we've continued that since the merger and have expanded our behavioral health services. But when you're looking at seniors, there are about 60,000 seniors in the county right now. As I referenced before, 25% of them are socially isolated. You have folks that are living on fixed incomes. You've seen changes in the benefits programs that have been allocated to seniors. And so to answer the question about behavioral health services across the board, no, there's not enough capacity available to serve everyone. We have a geriatric psychiatrist that comes out 1 day a week to our facility. It's the only one around. There's only 2,000 geriatric psychiatrists in the country, and we're lucky to have one. The Medicare system has made some evolutions in the last few months to allow a broader scope for counselors to see it. But up until January 1st, the only people that were allowed to provide counseling and be paid for it were licensed clinical social workers. So not licensed clinical professional counselors, not LSWs, not LPCs. So you had a limited pool of people who were available to provide counseling services. And so at the end of the day, seniors are a growing piece of our population. Everybody remembers there's 10,000 new seniors every day, not in McHenry County, but across the country. So that is a growing population, and we aren't prepared as a country across the board to meet the need of seniors, let alone in the behavioral health side of the world.
Okay, thank you. Let's go back to the board member. How do we expect businesses to be affected by the sales tax?
Well, businesses, depending on what market they're in, are going to pay the 1/4% tax to the state, which then sends it back to us. So, I mean, they're going to. I mean, I can't say that they're going to pass it on to their customers, but they're somehow, some way that's going to be paid, whether it's through the customers or the business itself is going to absorb it.
Always.
I mean, yeah, I mean, because it hate to say it, but you're always going to pay your sales tax. I mean, it comes on your bill, so you're, relatively speaking, the consumer's going to pay it.
And I can add to that, and then I'll let John add to that as well. I actually talked to several small business retailers to ask what they thought that impact was, and to a person they said, nobody's going to notice that. It's a very, very minute amount, so there will be no impact from their perspective.
Well, I would just add in that when you talk about businesses as a scope, this is a retail sales tax, so it does not affect the service side of the industries that we have. So it's not that I'm not diminishing the impact of the sales tax, but it's not affecting all businesses across the board as collecting and providing it in.
Okay, this one might be related to that. Does the mental health sales tax impact gasoline prices at the pump in McHenry County?
You don't pay sales tax on, you pay a bunch of other taxes on fuel, but not sales tax.
I believe McHenry voters approved a property tax to fund mental health a few years ago. Why is sales tax a better way to cover these costs?
So can you repeat that real quick?
Sure. I believe McHenry voters approved a property tax to fund mental health a few years ago. Why is the sales tax a better way to cover the costs?
Well, I don't know what they mean by a couple of years ago, but to me, it's an option. It's an option that voters can say yes or no to. I don't know that it's better or worse. It again goes back to the chart that was up here about your home value and how much you purchase of the goods that ultimately has a sales tax attached to it. To me, it's an opportunity to provide more money for mental health and for the mental health services that the county needs. But I can't say it's good or bad. It's just a different way of doing things.
And just to be clear, that was back in 1967 that the referendum passed to use property taxes. And I think that what we're finding over time is because of the pressure on property taxes for all sorts of services, is making it very difficult to fund this appropriately. So to Mike's point, everyone's going to have a different opinion about whether this is the right way to go or the wrong way to go, or personally. But the fact of the matter is, if we do believe that there is a mental health crisis and we are underfunding the services here in the county, then this is one opportunity to make sure that those resources are available to our residents. And I would argue that it's far better to pay for preventative and treatment up front than to wait until a full-blown crisis. Think about the fact that our social worker program, we're going to save a lot of money In addition to the fact that a lot of people say this is the right thing to do to take care of people who are in a mental health crisis, but you're going to save money by taking care of the problem up front.
Okay, thank you. This card has a suggestion and a question. First, the suggestion. Could you add the opportunity for people to pose questions on the county's site with a question and answer document?
To post the questions up front on the county website, is that what it's asking? I didn't.
I'll read it again. Add opportunity for people to pose questions on the county site, I'm assuming website, with a Q&A document.
I suppose we could see about having additional questions that are sent to us to put out on our FAQs, so that we could be answering them that way as well. That's a great idea.
Okay. Now here's the question. Should this pass, would the county board be able to add another or increase taxes in its stead?
If this passes, it fully removes the levy for the mental health board from the county's aggregate. There is no money sitting there to re-establish that levy. It is off of the county's aggregate. It would be strictly the sales tax. And, yeah.
Well, so what Carolyn just said is true. The only way you could go back and add it back in again would be to go back to the voters and get approval through a referendum to have that levy added back on, to the McHenry County tax levy. So once it's removed, it's removed. It's on the sales tax as far as how that gets funded. Again, we could always go back to the voters at some point in the future on another referendum and ask to change it back again or do something different again, but again, it would be up to the voters at that point.
Okay, I think this question might be related to that. How can we be assured that if the referendum to add a sales tax passes, that the county board will not continue taxing real estate for mental health?
Because that's how the question is. So again, in finance, we had a question, we had this debate because, and we had to get the state's attorney's office involved because, it's a legal question. So naturally, we're trying to make sure that what we're doing is legal and that it can't be challenged, or if it can be challenged, that it's sustained, that the question is a valid question. And so again, it's when we were in finance committee, it was critical, I think, for the members of finance and for the whole board to make it very crystal clear that that can't happen. We didn't want to, the wording that we got originally at committee was, I'll say wishy-washy, vague, not very clear, and I'm like, that's not, we're not doing that. We don't want that. And so it was, again, we probably spent a good hour and a half at a committee just wordsmithing this question so that it would be as crystal clear as possible, and then going back to the state's attorney's office, who was there, and saying, this is what our intent is, make sure this question absolutely, positively takes that possibility and makes it removed, so that it has to be removed from the property taxes.
And I would also point out that it's really difficult being a referendum question because it has to be a yes or no. So that was the challenge that we were finding, was trying how do you ask this as a yes or no question so that people are clear that if you vote yes on the sales tax, you're definitely taking that property tax off. And there was a question by somebody on the board about keeping a placeholder on our property tax levy, kind of just in case the sales tax kind of really fell through the floor. And the answer was no. That did not get picked up, and we voted on that because we didn't want the appearance of double taxation. So that is not going to be on there if this passes.
Okay. Next question. Has the tax levy been extended to the full amount allowed?
So that's kind of a tricky question. So I'm going to break it down a little bit. So I'm going to do an analogy here. So the property taxes for the county, picture that as, I like apple pie, so picture it as an apple pie. And how the county board decides to break up that apple pie with all the different levies, there's 11 different levies, the county board can decide how much of that apple pie goes to each levy every single year. So to answer that question, I'm assuming you're talking about the mental health side of the levy. I'm making an assumption there. And so the county board could theoretically take the entire levy and dump it to mental health. You know, theoretically. We wouldn't be able to fund all the other things that we're doing, the 28 departments that we have. But when you talk about a levy rate, we can adjust the rate up or down every single year for each of the different levies in order to try and meet the needs of those particular levies. So it's a little more complicated than what the question kind of implied, but ultimately we could levy more for mental health, but we'd have to take that from somewhere else. We are limited in the amount that we can raise the overall apple pie by, because we're a tax cap county, so we can only maximize that with the CPI or 5%. And we already know what CPI is next year, so it's less than 5%. So we can only increase the apple pie by, in essence, CPI every single year. If, again, the board chooses to do that, we have been very frugal and have not taken the full amount of CPI every single year. So, again, depending on your perspective, either shame on us for not taking as much as we can, or thank you for not taking as much as you can. Again, both sides of the perspective, right? But so I hope I'm answering that question, and if not, I'd be interested in how else I can try and answer that.
I think what I would add to that too is if you're looking at the mental health board, they received $525,000, which was roughly 5% of their tax levy. And if they were a standalone agency able to raise their own levy, that would have been their cap, right? But to Mike's point, because it was aggregated with the county total and we don't take our full levy, we don't capture the full CPI, they could have theoretically gotten more than that. Again, it was a challenge getting the 10 votes to get what we got.
Okay, thank you. Let's see. Just off of that topic a little. What are the top 2 areas that need to be developed in our county to meet the needs of our people? Bring anybody. Top 2.
Your levy question, please. I don't know there's a short answer to that question, but if you look at the Healthy Community study done by the Mental Health Board, if you look at advocate study, so in the state of Illinois, hospital systems have to do their own community needs assessment every 3 years. The Mental Health Board has their own, also determined by state legislation. So you have these ongoing rolling assessments of needs in our county. And consistently across the board, year after year, you see behavioral health services, the lack of capacity, and the growing need showing up. And so, and how that looks is going to be unique into our county. So we do not have in our county an effective, that may not be fair to say, well, we don't have a youth inpatient, outpatient program. So the families in our community have to travel to Hoffman Estates if they have children with significant behavioral health needs. And you talked about your daughter. I had my younger son went through some significant health issues, and that's a burden in of itself to a caregiver to have to try and manage their loved one's needs. And we talked about the caregiver burnout before. Imagine having to drive to Hoffman Estates every day to take your 8-year-old who's got significant health issues, behavioral health issues, to be able to get them day in, day out the care they need because you cannot find it here in the county. It's the same for significantly disabled, intellectually developmentally disabled adults. There's not a place for them in our county. Substance use in our county, the number of people that are dying from fentanyl overdoses, accidental. I mean, this isn't folks that are, these are accidental overdoses. They are buying something that they don't know is laced with fentanyl. So you saw in the slides, Live for Lolly was handing out fentanyl test strips. That saves lives because there are people dying from smoking marijuana that's laced with fentanyl, doing cocaine that's laced with fentanyl. They don't know it's laced with fentanyl. So that's saving their lives. So I don't know that I could pinpoint to one or two particular things because it's also, it's all connected, right? Health, mental health, our community, our quality of life, it's all interwoven. But I would say that year in, year out, the data points to behavioral health services being a significant issue in our community.
Anything else?
No,
Okay. Okay, thank you. Why was, this is for a board member, why was the primary ballot rather than the general election, when voter turnout is higher, chosen for this referendum?
Well, we had that debate. We had a good long discussion about it. I don't know that there was a right answer or a wrong answer. So for county government, you know, the budget process for us starts basically March 1st with a budget policy, and then subsequently start building the budget. Our concern, my concern, was that if we waited till November, we will, in essence, have already pretty close to built a budget and try to pass a budget. And with this being such a large unknown at that point in time, you almost have to try and build two budgets based on a yes or no answer to this. And it becomes more challenging for everyone involved. So the board, we had the discussion. I mean, I don't think there was a right or wrong answer to it. It was just that most of the board members wanted an answer sooner rather than later so that things could be planned and budgeted. And not just from the county standpoint, but also from the mental health board standpoint. You know, and actually, if the paradigm is changing as to how you get funded, they have to be ready to set that up also. Because again, that money, you know, from the county's perspective, you know, we get the money in two big chunks when you pay your property taxes. Mental health board is not going to be funded that way. They're going to be funded on a monthly basis with, because sales tax, we don't actually receive that money for about 2 to 3 months after the sales tax has happened, because it goes through the state and there's a lag. So, you know, they got to be prepared that they're only receiving $1 million a month, roughly, once it gets going. So even though, you know, there was a question earlier about the double taxation, technically that's true, but from a funding perspective for mental health board, they're really not going to see that revenue because of the lag for sales tax coming in. So for the first 3 months of that, they're not going to see a cent, because that's how long it takes for them to actually get the money. Once they get the money, they're only going to be getting, you know, let's just say on average $1 million a month. So their paradigm about how they distributed money is going to have to change, because they don't have a whole big chunk of money that they can suddenly, you know, divvy out to a whole bunch of different providers. That's going to have to be, okay, well, you know, you're going to get this money, but you're only going to get it in little chunks as we get it. So there's a whole bunch of planning that has to go on, and we felt it was better to have it done, a majority of the board, I should say, felt it was better to have it done sooner rather than later.
And I would agree with everything that Mike just said. I think it's such a difficult process for the mental health board to go through every year as it is. It's easier for them to know up front if they have to repeat that process or not.
Okay, thank you. Next question for the board again. Is the county legally able to fund the mental health board with property tax and sales tax?
Yes. Yeah, I mean, we could easily, we could keep that levy still as part of the property tax levy and also do the sales tax. I don't know why we would do that, but I mean, yes, that technically I mean, this question doesn't set it up that way, but the board could have voted to have it set up that way.
Okay, next question. Why hasn't the Mental Health Board created a not-for-profit to raise needed funds instead of raising taxes?
So I'm going to answer this one for them because I was at one of their not-for-profit educational things, and every single one of these agencies is a not-for-profit that's trying to raise funds for themselves, and they work really hard at it every year. And so, setting up a separate nonprofit, this is already being done by the agencies.
Okay, good. Okay, we have one final, I think this is for Suzanne. How will the funds raised from the sales tax affect the uninsured county residents?
It's interesting to see that it would segregate the uninsured. It will certainly help significantly. As I had said, with my daughter, we had great insurance, and yes, we had to go to Hoffman Estates. The uninsured don't have that option. And so they rely on the providers that are funded by the Mental Health Board to be able to get psychiatric services, to be able to get counseling services, to be able to get substance use disorder services, all of the range. It's not only the uninsured who are benefiting from this mental health services at all. Some of the other options that and the programs that have been run are the suicide prevention training for the entire county. So that affects absolutely everyone. So this is not just the Mental Health Board doesn't just fund services for the uninsured. It's certainly a big part of it because there is no other place to go for services if you don't have insurance. But the Mental Health Board, the funds do even more than just that and really do touch all of our lives. And I'm pretty hopeful that that answered the question.
I would also say that there's a pamphlet out there or a sheet of paper out there. It's about 4 pages long, and it's been provided by the Mental Health Board, and it really takes a deep dive into the programs that they offer, the amount of funding that goes into it. It's a lot of information, but if you want to grab one of those, that will give you more information about where those dollars are going.
Okay, thank you. If there are no more questions, I think Paula Ekstrom has a statement she'd like to make, but I'd like to thank you. This is a very informal or informational, educational panel. Thank you all.
I will say just quickly, we do have other information out there. The FAQs are printed out for you. What's the other thing? Oh, get the minute. And the reports from the Mental Health Board. What's the other one I have out there? Oh, actually, the information about voting, where you can go to vote, like for early voting, locations, times, for all the places between now and the day of election. So there's good information on the table out there. Please feel free to take it.
I wanted to make one more addition to the voting information, and that is that Illinois is probably the only state where we have 17-year-olds who are allowed to vote in the primary if they turn 18. And your slide pointed that out, but I just wanted to make a special effort to say if any of you have 17-year-olds, they can go online and register or go in person and register and vote in the primary. And I want to thank everyone for coming. It certainly has been educational for all of us.
Thank you so much for having us.